Hi there. In this video, we will be discussing misconceptions that can lead to stigma about people with dementia. This video is part of a series on how to identify and reduce risk factors for dementia. Dementia is a general term for loss of memory, language, problem-solving, and other thinking abilities that are severe enough to interfere with daily life. Alzheimer's disease and vascular dementia are two of the most common types of dementia. What do you think of when you hear the term dementia? You probably thought of it as memory loss, confusion, or just a thing that happens to most people when they get older. In this video, we are going to examine the assumptions that people have about dementia and help you better understand what it is and how it affects the people living with it. Misunderstandings about dementia and the people who have it can lead to stigma. Stigma is thinking about something in a negative way or having negative views about something, such as dementia, and those who live with it. Stigma can lead to discrimination. Being stigmatized may have harmful consequences for people with dementia. They may have poorer self-esteem and feel ashamed because of the stigma associated with dementia. They might also feel excluded from social situations, which can lead to social isolation and depression. People with dementia can be aware of the stigmatizing views and attitudes about their condition, and they may internalize this information. Internalized stigma means that people with dementia might start to believe the negative messages they receive about their dementia, which can negatively impact their well-being. Stigma about dementia may also prevent people from seeking help from their doctor because they feel shame about the symptoms they are having. When someone has dementia, their caregivers or family members may also experience stigma because of their relationship to the person living with dementia. How can we avoid perpetuating this stigma? For starters, we can learn more about dementia. Dementia happens when there is damage to the brain that makes it hard for brain cells to communicate with each other. There are many types of dementia. Some types can be triggered by a medical condition, such as a stroke, Parkinson's disease, or Huntington's disease. Another type, called Alzheimer's disease, is the most common type of dementia. Dementia involves difficulty with short-term memory. This might involve being unable to recall what one ate for breakfast, or finding it difficult to answer questions such as, "What did you do this morning?" because it requires them to use their short-term memory. However, most people with dementia can still access their long-term memory. This means that a person can share what their favorite hobbies are, or talk about their previous job and details about their family growing up. They will also likely be able to remember these details accurately. So now that we know more about dementia, how common is it? Approximately 50 million people have dementia worldwide. Those people are generally older adults, and if a person younger than 65 has dementia, it is considered to be young onset dementia. But dementia is something we will all get, right? The answer is no. Dementia is not a normal part of aging, which means that the majority of older adults will not develop dementia. The good news is that there are ways to reduce the risk of getting dementia. It is never too late to start these strategies. Some of these things include doing intellectually challenging activities, such as reading or playing board games, exercising, connecting socially with others, keeping a healthy weight, not smoking, and not drinking heavily. Although some risks for dementia can be reduced, a person is not at fault if they are diagnosed with dementia. We know what factors tend to increase the risk of dementia, but there are many other reasons why dementia might occur. There are also many risk factors for dementia that we can't change, such as a family history of dementia, which implies a possible genetic cause. Now that you have learned facts about dementia, what are other ways that stigma about dementia can be reduced? We can change the way we interact with people with dementia by learning how to talk and connect with them in a more effective way, taking into account not only what they have lost, but also the skills and abilities that they still retain. Here are some things you can do to optimize your attitude, language, and your interactions with people with dementia. With respect to attitudes, we can start by being aware. All individuals with dementia are unique, and it is important to treat them with respect and dignity when interacting with them. It is important to also view a person with dementia as a whole and not just their condition. Remember, they are human just like you and once lived a life that was not as challenging as they are living now. People with dementia can live happy lives and can be involved in interests and have fulfilling relationships. Lastly, it's important to acknowledge that not everyone with dementia is the same. Every person has their own preferences on how you interact with them. You can also be aware of your language when talking to someone who has dementia. Avoid making jokes about someone who has dementia or their memory limitations. Be mindful of how you refer to people with dementia and avoid addressing them as a sufferer or victim, as these words carry a negative stigma and stereotype about those with dementia. Earlier, we discussed how people with dementia may face difficulty with remembering things that recently happened, known as short-term memory. Because of this, it is best to avoid asking a person with dementia, "Don't you remember?" as this question can cause that person to feel frustrated and embarrassed due to being confronted with their memory challenges. You can also adapt how you interact with people who have dementia to promote positive interactions. For example, try focusing on the person and not their condition. Being more accepting and flexible with a person's difficulties, feelings, and experiences can create a positive impact, as people with dementia want to be included. You can do this by engaging the person in conversation and activities. In conversations, if a person with dementia tells you something that is incorrect, try to understand their point of view. For example, they might tell you that they have to get to work, even though they have retired. Trying to correct them might actually make the person more confused or upset. Instead, try to carry the conversation on their terms so you can enjoy each other's company. If you have a loved one with dementia, you can start conversations by saying, "I was thinking," and then saying some sort of information that is relevant and enjoyable to the person you are talking to. You can mention the person's favorite activity or a place they like visiting. For example, "I was thinking about how much I loved the chocolate chip cookies you made when I was little." Be open to learning about the person, such as what they enjoy doing and their strengths, rather than focusing on what they can't do. Learning about the person with dementia can teach you how to best interact with them and can give you ideas about topics you can converse about. For example, learn about what songs they like, a funny memory that makes them happy, or if they had a favorite pet. All of these actions combined can positively affect the lives of those living with dementia. If you are a caregiver of someone with dementia, it is important for you to seek support and care for yourself as needed too. You might want to get support from a health professional, your friends, family, or support groups. Getting this support when needed is not only good for your well-being, but it can help you be more responsive to the needs of your loved ones too. It is helpful if you can take time to participate in activities you find fulfilling, such as socializing with others, taking breaks, relaxing, and maintaining good nutrition, sleep, and self-care.